familiar with bladder pain? Bladder pain, often referred to as cystalgia, can result from various causes and is characterized by a sensation of pressure, fullness, or discomfort in the bladder area. Common causes include urinary tract infections, which leads to inflammation, and interstitial cystitis, a chronic condition that causes bladder pressure and pelvic pain. Today on Ask the Experts, we have a specialist who will explain what bladder pain is and ways to combat it.
Bladder pain is typically pain that's associated with the bladder or felt to be in the bladder by the patient. Now, it can develop from a lot of different things. Sometimes people just develop it from hereditary. It runs in their family. It's very common with people with endometriosis. The other thing is I've seen people who have developed a bad UTI, and for whatever reason, they treat the UTI, but they still have pain because genetically or environmentally or whatever, they're susceptible to now their bodies develop pain. Bladder pain is difficult to treat because it can come from many different sources. And a lot of times we don't really know what causes it. So there's multiple ways to treat it. One way is medications. There's some oral medication. There's one medication that coats the bladder. A lot of the medication treats the nerve pain. The other way is actually instilling medicine directly into the bladder. And then there's things like injecting Botox into the bladder to help with pain. Because of how it works, it actually reduces some of the abnormal chemicals that are causing the pain. And then a neurostimulator for the bladder that works on the nerve to the bladder and the pelvic floor area. One thing people with bladder pain do tend to develop is pelvic floor dysfunction as well. So you have to treat that as part of it.
This segment, Ask the Experts, on Today at 11 is sponsored by Urogynecology Associates in Flowood.